introduction, but we're going to go ahead and get started. Welcome to today's webinar, Unspoken Truths, Being a Young Person in Advocacy Spaces. My name is Jackie Zimmerman, and I'm the Manager of Public Education Partnerships and E-Learning at our national office. And I am joined today by my colleague, Jackie M., and some amazing voices from our Youth Leaders program to share about advocacy and being a youth in an advocacy space. We have some really great individuals that'll introduce themselves in a moment here. But first, I just have a few notes for our session today. This webinar is being recorded and will be emailed out to all registrants within 1 week. We currently do not offer CEUs, but if you would like to request a certificate of attendance, we do have a form that you can fill out to request one of those. I'll put the link to that in the chat here shortly, and then that will also come in your follow-up email. So that follow-up email will have the recording, the link to request a certificate, and any resources that are shared throughout today. We will note that your cameras are automatically off. Like I said, your mics are muted and they'll stay that way throughout today's session, but we will have an opportunity for you all to have some questions answered by Jackie and our guests. So please feel free to put those questions in the chat throughout the session. We'll be collecting those and then go through some of them at the end. And without further ado, I know we have a lot to pack into this session, so I don't want to take up any more time. Welcome, Jackie and guests. I'll hand it over to you.
Hi, everyone. Thank you so much for being here. My name is Jackie Manhivar, and I'm the manager of peer and youth advocacy here at Mental Health America. It's so heartening to see so many folks coming out here to listen to what young people have to say from our organization, and I'm excited to share. Before we dive into the panel and I introduce you to some of our incredible young change makers, I'm actually going to present just a few slides to give you a little bit of background and context on what we're going to be talking about today. So let me share. Cool. Hopefully you all can see that. Let me know in the chat if you cannot. But again, just a little bit of background for today's conversation. So this is our 2022-2023 Young Leaders Council. They just finished their term this past spring. And our Young Leaders Council is a program here at MHA. We recruit young people from across the country, ages 18 to 25, who created programs and initiatives to fill gaps in mental health support and resources in their communities. Each year, there are 10 leaders who are selected to participate in this program. It's 6 months long, and it culminates in an annual report. Every cohort gets to release a report with their recommendations and just generally a platform for them to say the things that they'd like to say in the world of mental health advocacy and youth mental health at large. So these are some examples of our past reports. These are all available to download on our website as well, and I can share that link later on. So as you can probably tell, each year's cohort has its own sort of specific point of view and perspective. In these annual reports, it's always really interesting to see what comes of each year's council and the ideas that they really want to express. So with this year's council, we did some early brainstorming. I don't expect you to be able to read these sticky notes. They're all very small font, so you most likely cannot. But this is just to show you kind of what the early process looked like. It was very collaborative. We did a youth-led co-design process. So just wanting you to know that the report and everything that came of it came from the young people in our council. We didn't come in with any ideas of what it was going to look like or what it should look like. We really let the folks in the council spearhead and lead the way when it came to that. So in our early brainstorming, we were just thinking through the things that folks had learned both over the program term and over the course of their advocacy journeys at large, and the lessons they came to learn, the things they came to understand, and what they felt was important to communicate to others. And that led to this year's annual report, Challenging, Sustaining, and Evolving, an anthology on youth mental health advocacy and hope. So a couple of key themes for this year's report. Youth voice was really important. This is actually the first time that our report has taken the form of an anthology. So 6 council members each wrote a section for the report with a personal advocacy story that kind of reflected some of the themes that we were trying to get across. So really cool because it's told in their own words from a first person perspective what it's like to be in these spaces and trying to bring about change with all the challenges that come with it. Identity was also huge. Our group is hugely diverse in so many different ways and have so many unique perspectives and lived experiences when it comes to this work. So it's really important to be able to highlight each of those. Community care was a recurring theme. All the folks, even though, like I mentioned, all come from such unique perspectives. Community care was kind of a through line in everyone's advocacy stories and the importance of that. And finally, hope. You know, we talked a lot about the challenges of creating hope, maintaining hope in the face of sometimes frankly hopeless situations. So really would recommend checking it out, and we will share a link to the report as well. So this is kind of the overarching kind of thesis, right, of the report. In mental health advocacy, young people are finally being invited to the table. Now what? For so long, the conversation has centered on we need young people, we need to include young people. But once you have young people in the room with you, how do you actually empower them to create change, right? So I'll share just a couple slides with a couple quotes from the report. Again, this anthology was created from a first-person POV, so these are all their own words. This is Mariama Ba. My understanding of advocacy evolved over time. I realized that advocacy meant more than just awareness. It meant providing tangible solutions. From Crystal Widato, my experience with this movement is complex, not because I am weak, but because I truly care about the work I do. And finally, Faria Tavakoli, I am a community advocate. I am a young person. I am everything they tried to erase. I am alive. So yeah, some really lovely words in the report, and you can read the full report here, mhanational.org/youth report. Take some time to dig through it, but today we're just going to be meeting with some of the young people who helped create and bring this report to life. I'm so excited for you to meet them. So I'm going to go ahead and stop sharing now and invite my panelists to come off camera so that I can introduce you. And again, these are members of the 2022-2023 MHA Young Leaders Council. If y'all want to go ahead and say, hey, we'll start with Savannah.
Good afternoon, everyone. My name is Savannah Fry. I am someone who identifies as being in long-term recovery from opioid misuse as well as mental health challenges, actually coming up on 6 years in a couple of weeks. And that is something that not only fuels my advocacy, it is the core of who I am, and being able to not only work with Mental Health America and be able to share those lived experiences, but also being able to I work as a peer recovery specialist. For those who don't know, that is someone in the state of Virginia who identifies as having lived experience with a mental health and/or substance use challenge. I was doing direct peers work for a little while within local adult detention center, as well as our drug treatment court and mental health docket teams, and am now moving up in the world of peer support as the regional coordinator for peer recovery specialists and family support partners. That has been something that has been a huge um, dream of mine, because really getting into peer recovery work originally, there wasn't a career path, there wasn't a ladder that I saw, and being able to be the first person in this position, be someone who's a young person in this position, is huge. And I can't wait to see how I'm able to expand, and really have already started to expand that role and create those opportunities for people just like me. So as I said in the report, you know, we want a seat at the table, not just on the menu. And so that is something peer support is able to do for me. And that is a little bit about me. Can't wait to
Thank you so
tell a little bit
much.
more.
Yeah, thank you. I'll pass it over to Mariama.
Hello, everyone. My name is Miriam Abba, and I have a nonprofit called Nation of Diversity, and pretty much with the experience that I've went through with sexual abuse and sexual trauma is what led me to be an advocate for mental health. And I feel that there is so many unspoken voices, especially around the youth, that, you know, I want to be the person to have to advocate for others who are not able to speak their voice. And I want to be the person that push them to, even though if you have a shaky voice, you know, you're a lot of things in your mind that you're going through, you're able to still be able to speak up and be there for other people. And so being here with Mental Health America throughout the year has given me the opportunity to really expand and know myself and know the work that's around that we are capable of doing. So yeah, I have a lot more to say later.
Thank you so much. And Jill, I'll let you introduce yourself.
Hi, everyone. I'm Jill King. I am based in rural Georgia, and I have dealt with mental health conditions for most of my life. A lot of my experiences have been based in struggling to access care in a low income area, which ultimately culminated in me just sort of using my voice very loudly because it was sort of a once you see it, you can't unsee it. You start making a lot of noise because you can't help it. And by the time I was in college, I founded a nonprofit called the Students with Disabilities Advocacy Group. Alongside my psychiatric disability, I am also blind and deal with chronic pain. And there's a lot of power in the disabled community. There's a lot of power in what we can achieve through innovative thinking and an accessible, inequitable society. And working with Mental Health America over this past year has been incredible, really just getting an idea of what we can do going forward, how we can work together to create hope in spite of the systems that really don't want that to be the case. So yes, that's it.
So glad you're here. And finally, Jose.
Hi, everyone. My name is Jose Caballero. I'm a sophomore at Columbia University studying cognitive science and Hispanic studies. And my advocacy is centered on mental health intersectionality, especially the intersection of lived experience and research. I think that there is a power when it comes to lived experience and storytelling as well. I always say that there's a lot to learn from stories. There's a lot to learn from literature and the science and the way we approach these issues. And as Jill mentioned previously, the way we approach equity. I really value and I care a lot about equity, and my initiatives and my work is centered on equity and leadership as well in youth spaces. Other than that, I'm thankful to share space with all of you and happy to see everyone again.
Wow. So as y'all can probably tell, we've got a really incredible group here, and I have a couple questions that'll help us get the conversation going to chat more about this year's report and in general the themes that we wanted to express and get across. The report is titled Challenging, Sustaining, and Evolving. Can y'all all elaborate a little bit of how that has taken form over the course of your advocacy journeys? How these themes how you've come to embody these themes throughout your advocacy, challenging, evolving, sustaining.
I think I can start. I think with change, a lot of the times I'm reminded of the past, the present, and the future. And I think that for me, I care a lot about storytelling. And when it comes to stories, I feel that stories teach us how to live. And for centuries and decades, stories have shaped how we think and what we value across generations. And I think that for me, changing and evolving and sustaining, there is a power again in storytelling, and that power lies in encouragement and representation of critical perspectives. And I admire this group and this program that Mental Health America has so much because it invites us to think about non-traditional ways of advocacy, which is also a way to advocate for mental health. And I think that an unspoken truth about storytelling is that we must learn how tools like this literature and stories have helped to construct today's structures of oppression in their glorification of myths and past tales, especially if we undermine their legacies and the expand of human understanding. I think that what I'm trying to say is that storytelling, in my case, it's a way to make my mental health advocacy sustainable, since I think it invites us to kind of envision the past we inherit, the present that we desire, and together the future that we want to build and the future that we want to cultivate together.
Yeah, absolutely. I feel like even with this report, like I showed the audience a couple examples from past years, past reports were written in a very different way. So this kind of reimagining of the report into an anthology with those first person stories is kind of revolutionary. I feel like that's a real act of revolution and resistance and challenging the what we usually see a report to be and what it should and can be, right? Yeah. Does anyone else have any thoughts, personal stories, or ways that you kind of see these themes showing up in your life and in your work?
I'd love to answer that actually. Within my work, it's very based in community care. We're a disability advocacy group on my campus, Georgia Southern, and a lot of my advocacy work just means showing up authentically in my experience, showing up, talking about what my experiences looked like, how it's looked to navigate these systems, and how we can thrive in them in spite of it. And it's been, a lot of challenging, a lot of sustaining, figuring out how we can work through these systems and also be there for one another. Because, having to constantly fight a system isn't exactly the friendliest thing to wrap your mind around, I guess, but it's necessary, and leaning on one another as a community has been really essential for me to keeping my own hope at going through it.
Yeah, just going off of what Jill said, I actually made a little note before about, just the power of rapport and the power of being genuine. I think that, as I've gone through the peer recovery specialist world, as I've, kind of found my corner of the recovery community, that's something that hasn't changed or evolved. It is that power, and, more experience for me has meant kind of refining skills that I already had brought to the field. I always say, I was doing peer support long before I was a peer recovery specialist. And so I think seeing that stay constant within an ever evolving field is something that I kind of cling to, but then you also see, as much as there are injustices, you can see where coming from lived experience, sharing your recovery story has so much power. And so with sustainability in a position that I'm in, I want to see that continue, and I want to see us grow as a workforce. And so the more you get a taste of, what something could look like, what our behavioral health system could look like, the more you want to create these sustainable programs that can replicate far beyond, anything that you could think of.
Yeah, for me, looking back into the report, this is my story. That was the first time I've shared what really have happened to me in the open wide space. I've shared it with the group here, but saying it in a report where the whole world will see what I really went through was very scary, but I know it was needed. And looking back and always reflecting, I feel like during the time that I was in college, if I did not have that peer support, if I did not created that group for myself and for the my college peer to be able to speak up and really share their stories, I don't think I will be here today. And I remember vividly, like, everything in me is like, don't say anything, but I did, because I knew that, like, a big part of me knew that I know I'm not the only one that's dealing with this. I know that there's a lot of us that's dealing with this problem. And when I spoke up and everyone else started sharing their stories, especially the sexual trauma story, I was very surprised, because most of these people, I've known them for a very long time. So looking back and being able to say, wow, I'm so glad I've said it, because if I didn't, I wouldn't be here today. So my advice to, everyone out there is just try your best and honestly do the research, make a plan, and and talk to people who are doing it. Talk to people like us, even though we might not know everything, we're still in the verge of, getting there. We're still figuring out our own things. And yeah.
Yeah, I love that. I feel like y'all really, really touched on something crucial that I think often when we talk about storytelling, it can feel like an extractive process, right? Of like doing this for other folks. And yes, it can help other people in their journeys and their healing, but it's also very healing to the self, right? When you share your story to be heard and to be seen so fully and deeply, I feel like that can really, it can help your own healing and kind of understanding your experience and communicating that. And you know, we did ask y'all to be pretty vulnerable in the report, you know, within boundaries. But wondering what that experience was like for you all writing your sections. What was the process of sharing your stories through this anthology like? Um, would love to hear, especially if you have thoughts on how other people, maybe adult allies who are working with young people in similar spaces, um, how can folks create a safe space for storytelling, and how can you practice self-care to protect yourself when storytelling?
For me, while I was writing the anthology, I had to really center myself. I had to do something that I really loved because I knew that I was stepping into a vulnerable space for myself. So one thing that I love to do is paint, as y'all can see my wall. I paint and I draw and I journal. So that I started painting and then I started letting my emotions, my trauma really come to me to be able to, you know, be vulnerable out there and show people my stories so that they're able to be relatable. And after that, it's like a weight off my shoulder, you know, like, okay, this is gone. I know people is gonna relate to this. And for me, the way that I've, you know, through my experiences and having community support that I have created for myself, we use art. Everyone is welcome in the group that we do. Like, for example, with my nonprofit, we have like the Circle Speaks. We do different form of art, and even those experiencing homelessness are welcome in this group because I feel like they are humans too. They are dealing with a lot of things that we are dealing with and that everyone could relate to. So creating that safe space and having adults in that room, not just like youth, but adults to actually share stories and come to me and be like, hey, you know, I did not have this opportunity when I was younger. I'm glad that, you know, you are creating this space. And especially these days, our adults need to speak up more. Our adults need to show that, you know, they are relatable to what we are dealing with ourselves. Because sometimes, like, when we are talking about all these things, and now that we are in the room and speaking about it, sometimes adults are able to tell us to, you know, like, you don't know anything, like, you have a long life to live and stuff. But when you start sharing your actual stories, the experiences that you've been through, they are relatable. They adults will relate to it and they will support you and they will be here for you. So being able to just be yourself and be able to, you know, connect with youth advocates and also like adults themselves, they are able to give you some advices and things that you're able to, you know, conquer yourself and the advocacy that you're doing.
Yeah, absolutely. It made me think of that saying of like leading by example too. I feel like talking about showing up authentically into these spaces, I feel like it's not just on adult allies to ask young people to like be open and vulnerable with one another. It's also, you know, be vulnerable yourself as well, right? And I say adult allies recognizing that like y'all are all also adults, y'all are 18, but you know, like the folks who kind of represent these organizations and these systems, right? I feel like it normalizing having conversations. If you're having a rough day, letting the group know and not feeling like, I can't express this because I'm the quote unquote adult in the room. I feel like it's good to put out what you hope to see reflected back. Yeah. Would love to hear the rest of the panel's thoughts on what it was like writing and telling these stories and the challenges that came up and how you make a safe space to tell stories.
Yeah, I as soon as you said storytelling, I think about part of the peer recovery specialist training is literally a section called the art of telling your story. And the more that I've gone through and been in the peer support world, the more that I recognize how true that is because you know, I've been in spaces where It's a safe space. People feel that they can share their story, but what comes out of it is a lot more of the kind of war stories rather than the recovery and where people are or where, they're at today. And so I think there's this balance that we have to strike as peer recovery specialists where we're sharing our stories and recognizing that some people might be at a completely different point in their story and wanting to always check in with them. And I think that's part of that safe space, is being able to remain authentic, but also check in with the person who you're working with and see how they're doing with certain things, especially if you've been working with them for a while and kind of their history and their background. But the other thing is kind of creating that safe space for yourself when you're telling your story. Again, I've had, multiple individuals that I've supported that hit very close to home because they have very similar lived experiences. And as I'm sharing my story, it kind of changes based on who I'm telling my story to. And so some things may come up where I'm like, oh, that was a little bit more, raw, or maybe I need to kind of work through that a little bit more, or, support myself a little bit more. So that's, I think, another big part of it, is creating that safe space for the person you're sharing with, but also for yourself as well.
Uh, you can go, Jill.
Okay. I was gonna say, I know for me as a leader, I've kind of found myself at a crux of hesitating to even be fully authentic, because it's, once you become a leader, your struggles don't stop. It can be very healing to do this advocacy work, to be the person that you needed when you were younger. It's been very healing for me. But struggles still happen. Life still goes on. I still have a mental illness at the end of the day. And I know for me, I've kind of gotten to a point in these spaces where I've had to quite literally tell myself to get over myself and be like, girl, share what's actually going on. They want to know what's going on with you, because that connection is how we can really get through this together, get through it and figure out how to thrive. And, I am still thriving, even if I'm still struggling. Both could be true. And I think kind of bringing that authenticity into spaces has been really important for me. And I know whenever I've had adults come into spaces with SDAG, it's been really good for them to see both of those things be true. So.
I think in the comments, Joseph brought something really interesting, which is kind of like this idea of mainstream storytelling with research and papers out there. And at least for my essay in the anthology, I really wanted to emphasize language. I really wanted to make my story to be accessible to people in the best way possible, and to encapsulate it in a way that it was true to myself, but it was also, I don't want to say generic or universal, but that it was just accessible in language wise. I feel that reading all of these research papers, complex papers, you don't really understand what's going on. At least I don't sometimes. So that is something that I really wanted to emphasize in my essay, just approaching my writing and approaching the way I tell my story in a very compelling way, that I integrate part of my identity, part of the things that I do daily, but that people can understand it really, really fast at the moment. And just echoing what Jill said, that I thought was really interesting when creating safe spaces, is also shying away from this binary thinking, meaning that there is a good story and a bad story, or if you're sad, that equates to being unable to fulfill happiness or to feel happiness. I think that creating a safe space at its core and the structure of that, it's shying away from that binary mentality and mindset that there's like two things that are always right. This is morality, this is not moral. And just understanding that listening actually helps a lot. Sometimes we just need someone to listen to us and not judge us for anything or give us unsolicited advice. I think that creates a safe space as well.
Yeah, I love that. Let's eliminate binary thinking. It's not right or wrong or good or bad. There's so much gray in between. And something like, one of the things of many things that I really, really loved about this year's report is that it really leans into the gray space, right? like we mentioned in our little introduction, for so long we've been encouraging young people to enter these spaces. We've been encouraging systems to include young people in their decision making and to invite young people, and we're seeing things like councils and advisory groups and focus groups popping up that are incorporating more and more young people. But I think it's not like, okay, we've won, like the binary switch is like, that's good, and now we're done, right? There's a lot of gray in between, and people's experiences in those spaces can be very gray. They can be both, being able to hold space for both the positive and the negative that comes with being an advocate in those spaces. So I'd love to hear more about y'all's gray areas in advocacy work. Thinking especially of when you're dealing with like particularly emotionally challenging issues or disillusionment, when you're feeling hopeless, when you feel like change isn't maybe happening. I'd love to hear about what those experiences have been like for you all and how you ultimately made it through, or not, acknowledging that there is no binary there, right?
For me, something that I always have to remind myself, like Jill and everyone was saying, is that like just because I'm an advocate now, that doesn't mean I have to have this facade of, oh, everything is great, everything is perfect. I can bring myself into this just keep everything to myself, and that even right now it's something that I'm still learning how not to do, especially like again what Jill was saying, like being a leader, like having a nonprofit, having people under you that you have to like take care of also. It's very easy to like shy away and like keep everything to yourself. But one of the things that I really, really, really love that we have started doing is having like all the volunteers and all the board members. We have one meeting once a month, and exactly what we are doing for the community is exactly what we decided to do for ourselves. That peer support group, right? So let's come together as a team and do art and really talk about what's going on with us and how can we support each other. And I found that it has been very helpful. It's something that I hope and pray that it keeps going, and that we are really supporting each other and understanding each other. And once we have that, honestly, it's easier to be out there and helps those that really need our support. So yeah, just you have that space, have the people that really understand you, because it's really easy to just sit in your mind and feed into that negativity in your mind. And if you don't have somebody to talk to, and you will find that person to talk to. Like it could be your mother, your father, your best friend that you didn't think it might relate to you, but they will relate as long you just say it and speak it out, and make sure that you have that space again for yourself to be able to be vulnerable. If not, then do something for yourself that you think might help. Journaling also might help, painting might help, going outside might help, taking a walk or whatever that you think might be able to center you in that gray space.
I know for me, it like most recently with my own mental health struggles, it's not really something that I'm able to fully disclose to those around me, just because I generally abide by the rule. If I don't know how to talk about it safely with myself, I'm not going to share it in a public setting. That's generally something I've always done. But I think having a close-knit group of fellow advocates who I can share what I'm capable of sharing with, like even if it's not the full gist of it, just sharing, hey, I'm struggling right now, and this is the truth of it. I need support. Where can we go from here? And just sort of just sitting in that space and accepting, like, yeah, this is tough right now. And that can be the end of the sentence until, you figure out what you need to do. And I know that's something that I've definitely had to learn to accept as I've gotten older, because I've always just been my advocacy started with writing, just sort of writing very openly and authentically. But it's good to keep things to the chest at times, keep things in a close group. I know basically my executive board on at my campus, that's my close-knit group. We keep things very close to one another, and that's honestly what makes our advocacy as strong as it has been. Showing up and being honest with one another and bringing that to our community. And when I get stuck in that gray space, I'm going to lean on that community. And that's usually what gets me through it until I can figure it out.
I love that. I love the reminder that it's okay to keep some things close to the chest. Not everything is for everyone, you know. There's some things that can be just for you and just for those trusted folks. Yeah, I that's just something that stood out to me.
I think for me, it's like start to realize what works for you as well. I know that I always say that writing is an extension of my healing process, but I always look out for support in other non-traditional peer support ways. I'm obsessed with Taylor Swift and Beyonce, and I think that that has helped in my recovery and finding hope again and refinding myself again. I think that finding these things that motivate you and that work for you are essential in understanding your condition, and it's part of the human experience as well. But more than that, I think that I find hope in the interchange of ideas, and that's why I love Mental Health America so much and this program so much, because at its core is there's a power that comes with ideas. Decisions are made with ideas. I think that the currency of our society and the entire world is based on ideas. So I think that just sinking in and understanding others' perspectives and challenging your own ideas and your own mindsets and mentalities really help a lot in understand yourself and to find yourself and to develop self-awareness a lot.
Absolutely. I would say I agree with all three of you and utilize pretty much everything that you were saying. I related a lot to what Mariama and Jill were saying about having that close-knit community that really understands your lived experience and shares those, but also finding your champions and people who are not going through similar things, but can have empathy and relate to some of those emotions that you're going through has been crucial for me. And then again, finding what works for you, understanding that for me in my recovery, what worked for me 2 years ago has changed, and that it's probably going to change in a few years from now, but also not being afraid to go back to things that have worked. I always have, kept track of what's worked in the past and may not work at some point, but maybe it'll work in the future. But just the other big part of it is just making sure that I am constantly checking in with myself and finding new ways to work on values that have remained the same, but may just need a little bit of tweaking, may just need a little bit of a boost to kind of get out. And then also recognizing that some of the systems that I'm working in, like working as a peer recovery specialist within a jail and, justice-based setting, that's never an easy thing. Working with insurance is never an easy thing. And so some things I'm just not ready to fully disclose, but I think one of the biggest things that I've always been able to kind of go back to is being able to still remain authentic in how I'm feeling and maybe not like getting too specific, because right now that's just not where I'm at, but always wanting to make sure that people understand if I'm not doing well, I'm not going to say that I'm doing well, and hopefully every space that I'm in can be that authentic. I know that they're not, but that's definitely the goal for me. And the more that I share my story, the more I'm able to identify those spaces where I feel more comfortable.
Yeah, absolutely. I think you touched on something really important, which is working within systems, finding ways to remain authentic to yourself and authentic to your community while working within these systems that sometimes are completely opposed to that aren't built for that kind of thing, right? And I feel like in like advocacy at large, mental health advocacy in general, like there's a lot of trying to change systems that feel really inflexible, that feel like they don't have that give for you to give it to show up authentically, and that change isn't happening quite as quickly as you'd like it to be. You're not seeing that sort of evolution, and that's why it's so important to build community amongst advocates, and also as adult allies be able to support young advocates when they face that hopelessness, when they hit that wall of like, oh, like this feels bad, this feels like the system is not going the way that I want it to go. So I'd like to ask y'all, what strategies do you use for building community with other advocates and being able to continue to do advocacy in a way that's sustainable and that you don't reach that kind of burnout point. Moreover, if there's anything that adult allies can do to support young advocates in these spaces who are dealing with that kind of burnout and disillusionment.
So going back to kind of something that I had shared in my experience, so I did direct peer support work for almost 3 years and then kind of moved over into my current regional coordinator position. And that was a decision that was made intentionally because unfortunately I had had a few individuals that I was supporting who had passed away while I was working with them. And it really rocked me to my core. I saw burnout happening before that happened. And then when that kind of catalyst happened, I could quickly see I wanted to be in the peer support world long term, but I knew if I was doing the direct peer support work, and at that point I was also working within the jail, working in the justice-based system, and it was very disheartening to say the least. And so I made the intentional decision, when this position popped up, I was like, I can still do what I love. I can still be my authentic self, be within the peer support field, but maybe direct peer support work just isn't the thing for me right now. It's ultimately something that I would like to return to. But I know, especially now, but it's back then I even knew that was the right decision for me. That was the way that I was going to take care of myself and take care of my recovery first. And that is something that peer support has really taught me. And being in a field where you already kind of know that people are their authentic, genuine selves, it's really easy to build community because it's already there. It's just a matter of, kind of like Mariama was saying, getting to know myself a little bit more and then doing the research, finding out, what organizations are doing what, who are the people that I can build that rapport with and build that community with. And I'm just so blessed to be able to go to peer support events or where our community of peers is, and everybody just hugs you and they're so genuine, and it's not like you're prodding or too much about their personal lives. It's a really interesting balance of being authentic in a professional setting, which I've been blessed to be in really, really safe environments, safe settings. And I think a lot of that has to do with just peer support and kind of the community that I've been able to find within my job, which is, I don't think a lot of people can say that. So it's definitely a huge thing for me.
Yeah, and going back to what you said earlier, I feel like kudos for knowing when to step back. I feel like that's a big thing when we're talking about trying to ease burnout, is knowing when it's okay to say, that someone else will do this and can do this, and it doesn't all fall on my shoulders. I feel like that's so important. I'm going to leave some space for other folks to answer if they'd like. And just a reminder that we'll be taking some audience questions, so drop your questions in the chat.
I think for me, it's humanizing activists as well. We're humans, and when you are in a leadership position, you're held to a different standard, even if you're young. People approach to you thinking that you know the answers to every single issue society is facing, and at the end of the day, I think it's just approaching people, individuals, with a compassionate sense of humanity, and I think that has worked for me. Just not labeling people in my community and making sure that they feel heard, they feel seen, and that you see that at the end of the day they're humans. We All of us are humans. And yeah, there is a hierarchy in society, and even within that hierarchy there's another hierarchy, but I feel that just understanding that we have a humanity and we need to be compassionate among each other. I think that has helped me just create a community among all of us here, the advocates, and yeah.
Yeah, I would agree. I would say the friendships I've been able to make among advocates, it's been meeting each other where we are. Like, hey, I see that you're doing this really great work. How are you doing? Because I know even if I'm at the height of like a really great project, I could be in the pits personally. um, and both can be true. And I would say that's something that I've definitely tried to be very intentional about in my friendships with advocates, is just being honest with one another about it, humanizing one another. Because there is a lot of pressure there to do this work and do it well. And it's like, I know I can do it well. It's just sometimes you gotta give yourself a moment, you gotta lean on your team. Um, and I would say, allowing room for that has been really big for me.
For me, this is my first advocacy group. So right now I am still trying to find, I think, my other advocacy group. Although like I have my nonprofit supporters and stuff, it's still not the same. Because I remember being in the space with you guys throughout 2023 was amazing. We all relatable. We are being there for each other. We're understanding each other, and we know the things that we were going through as an advocate. So for me right now, I'm in the stage of trying to find that again. What has helped, like I said earlier, also is going to like networking events and being able to, talk to those who are maybe in the same place but not fully in the advocacy. I've met certain people that want to become an advocate, but they're not really sure on how to start and stuff like that. So being in that space, networking and finding other organizations that's kind of doing the similar thing has helped me. So I think as I'm moving forward and trying to find my advocacy people, hopefully I'll get there. Maybe that's my goal for 2024, have that space and that group of actual advocates to be able to relate to and understand each other. So hopefully I get that by the end of 2024.
Yeah, it's so important to have that group of people who understand what you're going through. I feel like being an advocate for any cause it's tough work, right? Like we don't need to sugarcoat it. It can be hard work. So having folks who relate to those experiences, I think is so crucial. And Jill, I wanna emphasize something you said of being able to have conversations where it's not just about the work, because the work is important, but you're also important. So I love that you make an effort to ask other folks in the space, ask them, how are you doing? I'm glad you've achieved this. I see you have this event coming up or this thing happening, but how are you personally? It really sees the humanity and the individuality to everyone.
I
Let's
know.
turn it over to some questions from the audience. We might have to do a bit of a speed round here because we've got 10 minutes left. We're going to start with, have you ever been told that your struggles are part of life? If so, what do you think can be said about swaths of American society normalizing poor mental health experiences, especially among children and adolescents? And I'd love to expand this a little more to even talking about struggles even within advocacy, right? I feel like it's something that gets echoed sometimes of like, oh, that just comes with the territory, like, oh, that's just how things are, like it comes with the territory of being an advocate, this is just part of it, right? Yeah, what are y'all's thoughts on
For me, that question literally just reminds me something that I hear growing up every day, which is my parents, coming from an African background, it's everything is part of life. Everything that you do, like your mental health, your the struggles that you're dealing with in like at work with friends, it's just, oh, that's life. And for me, when that's been said to me, it's just undermining the feeling that I'm going through. And that's something that I am teaching my family, my parents, to like to show them this, although it is part of life, but I don't know how to deal with these things. How do I, you had life more than me, you've been here way before me. How did you deal with certain things that you had dealt with? How can you give me some advice and to be relatable, not just kick my struggles aside and be like, oh, that's just part of life. Okay, that is part of life. What do I do now? Like just sit in a space of depression and anxieties and stuff. So with that question, I think approaching whoever is telling you this in a way where you are more curious on how they handle their things. I think curiosity then it will provoke them to actually give you advices and actually, like help you out instead of just kicking your problems aside.
Oh, I love that. Yeah, meet them with curiosity. I feel like that causes the introspection to start to question like why is that? I remember some really great advice I got about doing youth like co-design and youth-led work is instead of saying like that's just the way it is, questioning why is it the way that it is, right? I think I love that. You really hit that on the head. Anyone else want to contribute?
I know in a lot of spaces that I'm in, a lot of people have already heard that. Like people that have either been disabled for a long time or otherwise, they'll hear a lot of, oh, that's just how it is. So they'll come into our groups and they'll be talking about what they're struggling with, and then they'll go, oh, but I know everyone deals with this. That's what this is like. It shouldn't be. It shouldn't be. We can acknowledge that, like, yes, this is something a lot of us have experienced, and we can also acknowledge that it sucks and it should be better. And there's steps that can be taken to do better. I think both could be acknowledged. And holding space for that, I think, has been very validating for my group to just acknowledge, like, yeah, that is ridiculous that we're having to fight for basic accessibility. It is ridiculous, but we're still going to do it. So.
Yes, I love that. I love that. It that's the way it is, but it shouldn't be. Like I think that's the unspoken follow-up, right? It shouldn't be. What are we going to do about it?
I think for me, it's also just acknowledging the fact that sometimes issues are much bigger than ourselves. And it's not a one-way solution to see it. It's just life. How do you tell an immigrant kid that immigrated from a country and then is adapting here in the US and feel alienated that it's just part of life and that's how you grow? I think that seeing that way is shying, again, like shying away from that binary view of like, yeah, this is how it works. This is the perfect formula to achieve healing. And this is the perfect formula for you to be successful in this country. I think rather that phrase is more perpetuating the intergenerational trauma that we all are trying to break. And I think there's a lot of healing that we as a civilization need to do. But yeah, I think just approaching that with a critical eye and making sure, as um, Mariana said about curiosity, I think that's a very great point, and emphasize that it's not only putting blame on yourself, but also see the systems that are before you. Because at the end of the day, there is a hierarchy, and at the end of the day, there, yeah, there's just like a societal hierarchy, and um,
Yeah, I don't think I could say it any better than them in terms of, just it almost reminds me of this saying, if you can't join them, beat them, which is something that I think a lot of us in advocacy, we find, okay, well, there's a crossroad at one point. You're either going to decide, this is too much and, kind of not do anything, or you're going to just integrate yourself even more, learn more, find those communities. And I think that um, is a crossroad that you hit a lot of the times in advocacy, multiple times. And a lot of it is dealing with those kind of things that you were told growing up, or things that you don't even realize kind of pop up in your thinking and the way that you operate. And I think that's a lot of being a young person as well in advocacy, is you're kind of unlearning all of these things at the same time. And it's a little overwhelming at times, I would say, to put it nicely.
Yeah, we're all always unlearning, learning and unlearning. And I think that's also great advice for like allies, adult allies in the space, is like allowing yourself to be challenged and allowing yourself to be wrong and unlearning some of those things that maybe need change. As we wrap this up, I'm going to try to wrap a couple questions into one. We've gotten a couple questions that kind of circle around into how adult allies can better support the work that you all are doing and the work that young people are doing. For example, we got a question about how adult allies in these spaces can share authentically without crossing boundaries, or whether it's better to have youth representatives in their own group or to include them in whole group meetings when you're inviting them into these spaces. I just would love to quickly hear y'all's thoughts on like what makes a supportive and empowering environment for youth advocates.
I'll just speak real quick to my experience when I was doing direct peer work. One of the biggest ways that I found peer champions and I found a way to really find my voice on an interdisciplinary team was being integrated in everything, going to the team meetings, having my supervisor refer me if they were meeting with other clinicians and case managers and they started talking and they were like, wait, Savannah would be a perfect fit. And as soon as I was able to get that foot in the door and really be involved in, those team meetings, that process, that's when I was really able to make a name for myself, name for peer support, because I was the only peer recovery specialist working with the entire community service board at that time. So finding the people who saw my value initially, but then were able to amplify it and give me that space for my voice to be heard was huge. So I just have been going back to that time and time again and really wanted to be able to express that because that was a huge thing, not only just again to get my name out there, but also to inform an entire system about this new role, this peer recovery specialist role, and the value that it held.
I think real quick for my answer, I think that we should emphasize that young advocates in these spaces are compensated fairly. I think that's a huge issue in these spaces where we come in and they think that, oh, you're gonna do a social media thing, so that's a hobby for you, so we're just not gonna pay you. But then you bring an expert that does less work than we do. Not to devalue anyone's work, but I think just that idea, some food for thought, just compensation for youth.
Yes, pay youth for their work.
Absolutely. And I'd mirror what both Savannah and Jose said, as well as I know some of the best engagement that my group has seen has been when adults have come in and just sort of met us where we are. Like, even if they don't have an exact shared experience, showing that they're actively listening to, what we're sharing in this space and they're thinking critically about it. And that's been sort of huge, especially because within higher education, being actively listened to is something that a lot of disabled students don't expect. And it's really lovely when we're proven wrong. So I would say that would be my add-on.
Yeah, piggyback on what Joe was saying. I would say that with my experience when it comes to adult allies, one thing that I really support, like I really love when they are part of the group, is when they express themselves that like they have dealt with these, whatever the situation was. They have, they've been there. And given us advice. For me, I think growing up, most of the time I've had so many adults that like dehumanize like my feelings and stuff. So when I have adults that's, like in the same level as me and actually understanding what I'm going through and being able to actually share the things that they have went through, give me more what is that word? It helps me more, actually. It helps me thrive more because then it's like, okay, I'm not just helping our youth, but our adults, allies is actually understanding what is happening with us. And there are a bunch of them, a lot of them who wants to support us, but it's just they don't know where to start and stuff like that. So going back to what I was saying again, going to these meetings, going to networking, things that youth are doing, and really understanding what we are saying and what we are doing in the community is the best way to really support us.
Yeah, thank you so much. I feel like that's a great place to wrap up this webinar. I feel like, everyone here has taken a great first step in terms of like actively listening to youth. I hope you've all taken away some great insights. I know I have a lot of great nuggets I've now stored away in my mind for future projects. So please continue to speak to the young people in your life and like Jill was saying, really actively listen and think critically about the things that they're saying. I'm gonna once again share in the chat a link to the annual report. So if you'd like to check that out, please do. And yeah, I'll toss it over to Jackie Z in case there's anything else I'm missing.
Yeah, thank you all so much. Thank you, Jackie. Thank you, speakers. It was absolutely fantastic to listen to you for the last hour. And I know I told you not to worry about looking in the chat, but if you took a peek, you would see just the outpouring appreciation from everyone who is listening. So thank you for sharing so openly and vulnerably with us today. I know there were a few questions to our speakers. If you all can pop your LinkedIn or any way to contact you in the chat. I know some folks wanted to get in touch or follow along to see where your paths go and what you're working on because they want to keep up with you. So pop those in there. And like Jackie said, we will be sure to we put the report in the chat, but also that will be included in your follow-up email. So all of those links you'll be getting within 1 week. This is being recorded, so you'll receive the recording. Please feel free to share this session. It will be public, and so you can share it afterwards. You can rewatch it. The link to request a certificate will be in that follow-up, and then also the link to our report and to get in touch with our youth panelists. So thank you all again. It was an honor to have you sharing this space with us for the last hour. Everyone have a lovely rest of your afternoon.